So, in general, Dr. Muniz, what do you look for in your day-to-day bread and butter composite?
There's a lot of things I look for in my day-to-day composites. Obviously, I need a composite that's going to allow me to practice efficiently. I care about handling, polishability, color stability, but not only what happens on that day. What happens when the patient comes back is just as important. So the way it works in my practice, every tooth that gets treated, we have a photo of. And then when the patient returns for their hygiene visit, we take a photo of the tooth that we repaired or filled. And so it's important for my hygienists and for my team, for myself and my patients ultimately, that that restoration looks great. Not just today, but for years to come. The other thing I look for is how my radiographs look. I need a composite that's going to look great radiographically as well.
And so, in that day-to-day routine, how does the Omnichroma product family fit into that?
The Omnichroma family fits so well into my workflow because it's simple. My team doesn't have to take a shade anymore, or at least when we do, it's extremely rare. The only thing I really have to worry about is, do I need blocker or do I not? And so it's easy. I love the handling, I love the polishability, I love how it looks when patients return. And so it's one of those things that I don't worry about inventory anymore. We don't have to worry about expiration dates because I don't have garbage just sitting around my practice that expired 2 years ago. I'm constantly utilizing what I have, and that's a big deal.
And so, I know you mentioned inventory. How else have the single shade composites as a whole affected your practice, whether financially or just generally?
When I think about outcomes for my practice, I think about a couple of things. One is financial, and absolutely, Omnichroma will facilitate for financial benefits. As I mentioned, reducing the amount of inventory and the amount of expired wasted material that we have, that's one. But also patient satisfaction and outcomes. When patients see that their restorations look great, not just the day it's placed, but then thereafter, it's incredible. And one of the best features is all of our teeth change from time to time. So whether you bleach or whether you just drink a lot of coffee, the restoration changes with you and will change with your tooth shades. So it's not like, oh, it looks great today and I don't know how it's going to look down the road. It's going to look great today and it's going to look great for years to come.
And so, our Omnichroma product family has two flowable viscosities, a medium flowable and a low viscosity bulk fill. Do you have a preference of where you use each one and why?
I use the different viscosities for different things. I love the bulk fill for restorations that are about 1.5 millimeters deep, class 1s. I think it's fantastic, easy, efficient, and reliable. I like the flowable to be used as a flowable. I still do use blocker when I need to, but I like a flowable, especially around a box or any areas where I'm concerned that my packing, it's not the restorative material, it's always operator error. If I don't think I can adapt, my composite really well to the wall, flowable works beautifully for that. I also utilize it for my provisionals. And so if I need to repair a provisional, or when I'm making a provisional, create a margin, or if there's a little void or something like that, I don't need a shade for every shade provisional material I have. I can reach for this and it's done. It's easy. And my team doesn't have to think about it. There's nothing worse than in the middle of a procedure asking for something and it not being right at your fingertips. It doesn't look good when your team has to get up and go find something. And so it's all right here and it's right there. And so for me, I utilize pretty much the whole Omnichroma family on a day-to-day basis. And so try it. I personally love the handling of Omnichroma, but it's nice that there is that variation. And so you might like more viscosity, you might like less, and it's really here for you, whatever you need.
And so, do you have any tips and tricks for either current Omnichroma users or new Omnichroma users that you can provide for them that you think have just worked the best for your practice?
Absolutely. I have all the tips. So if it's a simple class 1, class 2, you prep the tooth and the underlying tooth structure looks great, just try it. Don't take a shade. Just place omnichroma, and you won't believe how beautifully it blends with the adjacent tooth structure. If you get in there and you prep and you start to see discoloration, or if you're taking out an amalgam, something like that, then definitely utilize the blocker. I did something once just for fun where I placed blocker in a couple different areas of the same prep. And it was interesting. A little bit goes a long way. So manufacturer recommendations, stick to about a 0.5 millimeter of blocker. It might not seem like enough. Trust me, it most likely is.
All right, thank you, Dr. Muniz. We appreciate your time and your expertise as always. It's been a pleasure.